Have you ever sat in a cold doctor's office, explained the burning in your feet or the tingling in your hands, only to have them shrug and say one word? Idiopathic. It sounds like a diagnosis. It sounds official. But here is the truth they won't tell you. Idiopathic is just a fancy Latin way of saying, we have no idea why you're hurting. To a doctor, it's a filing cabinet. To you, it's a life sentence of gabapentin and learning to live with it. But here's the secret. Nerves do not just start screaming for no reason. Your body isn't glitching because you turned 60. There is always a source. Today, we are going to do the detective work your doctor didn't have time to do. We're uncovering the 4 hidden causes of nerve pain that are frequently missed in standard blood tests. And more importantly, what you can do to start cooling those electrical fires in your limbs today. Imagine you bought a brand new car, and the day the odometer hit 60,000 miles, the engine light started blinking. You take it to the mechanic, and he doesn't even lift the hood. He just looks at your keys, shrugs, and says, "Well, it's got 60,000 miles on it." What did you expect? Things just break. Here's a pair of earplugs so you don't have to hear the rattling. You would walk out of that shop and never go back. You'd find a mechanic who actually cares about the spark plugs, the fuel lines, and the oil. Yet, when it comes to our bodies, the most sophisticated vehicles ever created, we accept this exact same logic every single day. We've been conditioned to believe that once we cross the threshold of 60, our warranty has expired. We call it wear and tear. We treat our bodies like they are made of cheap plastic parts that have a pre-programmed expiration date. But I'm here to tell you that your nerves do not have an expiration date. Your nervous system is not a set of old tires that eventually go bald. Your nerves are a living, breathing, self-repairing communication highway. They are designed to last 100 years or more, provided they have the fuel and maintenance they require. Let's talk about what these nerves actually are. Most people think of them as dead copper wires, like the ones behind your drywall. But that's a dangerous misunderstanding. Your nerves are alive. They are made of delicate cells that are constantly talking. They are the highway that carries every single message from your brain to your toes. Every time you wiggle your foot, every time you feel the texture of a silk scarf, every time you sense the warmth of a cup of tea, that's your nervous system in action. When you start feeling those pins and needles, or that strange sensation like ghost bugs are crawling on your skin, or that terrifying lightning bolt that shoots down your leg while you're just trying to enjoy a walk, that isn't your highway wearing out. It's the highway sending a mayday signal. Think about a real highway. If a bridge collapses or there's a massive chemical spill, the highway doesn't just get old. It sends out flares. It puts up stop signs. It flashes red lights. That pain you are feeling, that is a biological flare. It is your body's way of screaming, "Attention! Something is blocking the road. The workers are starving. We need supplies." This brings us to the most dangerous word in the English language for a senior, idiopathic. When a doctor tells you that your neuropathy is idiopathic, what they are really saying is, "I see the smoke alarm is going off, but I don't see any flames on the surface, so I'm going to assume there is no fire." Imagine you're asleep in your bed. At 2 a.m., the smoke detector in the hallway starts shrieking. That piercing, high-pitched beep, beep, beep that makes your heart race. You're terrified. You smell something faint, something acrid. You run to the hallway, and there stands a man in a white coat. Does he look for the fire? Does he check the stove or the electrical outlet? No. He reaches up, twists the smoke detector, pulls the 9-volt battery out, and hands it to you. He says, There, all better. The noise has stopped. It was probably just an idiopathic alarm. You're over 60 after all. These things happen. You would be horrified. You'd be screaming. But the house is still full of smoke. This is exactly what is happening when you are prescribed a nerve blocker or a pain masker without anyone ever asking why the nerve is screaming in the first place. You are silencing the alarm while the fire, the underlying cause, is still charring the structure of your nervous system. You aren't getting old. You are burning up from the inside out, and the medical system is just handing you earplugs. Wear and tear is a lazy phrase used to end a conversation. It's a way to get a patient out of the office in under 15 minutes. If it were truly just wear and tear, why doesn't every 65-year-old have neuropathy? Why do some 90-year-olds have nerves as sharp and sensitive as a teenager's, while some 55-year-olds can barely feel their feet? The difference isn't the number of years on the clock. The difference is the environment the nerves are living in. Are the nerves being poisoned by something in the blood? Are they being starved by a lack of microcirculation? Are they short-circuiting because their protective insulation has been stripped away? These are questions with real, scientific answers. But you'll never find those answers if you accept the myth that your body is just falling apart. Your body is a masterpiece of biological engineering. It doesn't break for no reason. It breaks because it's missing a vital component or because it's being overwhelmed by an invisible enemy. I want you to make a pact with me right now. From this moment forward, we are deleting the words "just getting old" from our vocabulary. We are going to stop being victims of a shrugging diagnosis and start being detectives. If your nerves are screaming, they have a reason. And if they have a reason, there is a solution. So if it's not just age, and it's not just wear and tear, what is it? What is the fire that's actually burning in your hallway? Let's look at the very first hidden culprit, the one that 90% of standard physicals miss because they aren't looking at the right pipes. We're going to talk about the microscopic delivery trucks that have stopped showing up to feed your nerves. Now that we've agreed to stop blaming the year you were born for your pain, let's look at the first real suspect in this mystery. To understand why your nerves are screaming, you have to understand how they eat. Most of us think of our circulation as one big system. The heart pumps, the blood flows, and everything is fine. When you go to the cardiologist, they check your pulse. They might do an ultrasound of your carotid arteries, or they look at the big vessels in your legs. If those are open, they give you a thumbs up and say your circulation is perfect. But there is a secret world of plumbing that your doctor almost never discusses. It's a network so small that a single drop of blood has to line up its red blood cells in single file just to squeeze through. Scientists have a specific name for this, the vasa nervorum. If you translated that from Latin, it literally means the vessels of the nerves. You see, your nerves are not just passive wires. They are living, high-maintenance tissues. They are the most expensive cells in your body to maintain. They require a constant, second-by-second delivery of fresh oxygen and glucose. And they don't get that fuel from the big highway arteries. They get it from these tiny, microscopic side streets, the vasa nervorum. Think of it this way. Imagine you live in a small, remote cabin at the very end of a long, winding dirt road. The main interstate highway is 10 miles away. Now, the interstate can be wide open, with trucks carrying tons of food and supplies flying by at 70 miles per hour. The circulation on the highway is great. But if the bridge on your little dirt road washes out, or if a tree falls across the path, it doesn't matter how much food is on the interstate. You are sitting in your cabin, and you are starving. This is exactly what happens in the bodies of many seniors over 60. Your interstate circulation, your heart, and your big arteries might be in fantastic shape, but your dirt roads, those microscopic vasa nervorum, have started to collapse. When these tiny vessels shut down, the blood flow to your nerves doesn't just slow down, it vanishes. And when a nerve stops receiving oxygen, it undergoes a terrifying transformation. It begins to suffocate. Have you ever sat on your foot for too long? You know that feeling when it goes asleep? It's numb at first, and then, as you move and the blood starts to rush back in, you get that intense, prickly, almost painful waking up sensation. Now, imagine that waking up sensation never stops. When your microvessels collapse, your nerves are permanently in that state of suffocation. Because they aren't getting enough oxygen to fire a clean, clear signal to your brain, they start to glitch. They send chaotic, frantic bursts of electricity. Your brain receives a signal and interprets it as burning. It receives another and interprets it as wetness, even though your skin is dry. It receives another and interprets it as crushed glass. This isn't idiopathic pain. It's the sound of a nerve gasping for air. The reason it's so often missed is that no standard hospital test looks at the vasa nervorum. They are too small for an MRI. They are too small for an X-ray. You can have 100% perfect results on every test your doctor runs, while your tiny nerve vessels are 90% blocked. So why does this happen? Why do these tiny vessels suddenly decide to quit on us after 6 decades of faithful service? It usually comes down to the loss of a single, invisible molecule, nitric oxide. Nitric oxide is a gas produced by the lining of your blood vessels. Its only job in the world is to tell your blood vessels to relax. Open up. Let the blood through. When we are 20 years old, our bodies are nitric oxide factories. Our vessels are wide, flexible, and pulsing with life. But by the time we hit 60, our ability to produce nitric oxide has dropped by more than 50%. For some of us, it's a 75% drop. Without that gas, your tiny microvessels become stiff. They stay constricted. They become sticky, allowing little bits of plaque and waste to gunk up the works. Essentially, the dirt road to your nerves is being reclaimed by the jungle. The path is closing. I want to touch on something sensitive here. Many of you watching are on statins to lower your cholesterol. Now, I'm not saying you should throw your meds away. Always talk to your doctor. But there is a scientific reality we have to acknowledge. Statins are very effective at clearing the interstate highways. They lower the LDL cholesterol that clogs big pipes. But some studies suggest that long-term use can actually interfere with the health of the endothelium. That's the inner lining of your vessels where nitric oxide is made. So, you might have the cleanest big arteries in the world, but your tiny vasa nervorum are struggling more than ever. It's a biological trade-off that almost no one warns you about. You're protecting your heart, but you might be accidentally starving your feet. The good news? The dirt road isn't gone. It's just blocked. Unlike a copper wire that snaps, these microvessels can be persuaded to open back up. We can actually flood the body with the raw materials it needs to jumpstart nitric oxide production again. We can use thermal therapy to force blood into areas where the vessels have become lazy. We aren't just managing the pain anymore. We are re-wetting the garden. We are clearing the trees off the dirt road so the delivery trucks can finally reach the cabin. But before we talk about how to fix the plumbing, we have to look at the second hidden culprit. This one isn't about the pipes. It's about the insulation on the wires themselves. We're going to talk about a vitamin trap that millions of seniors fall into every year, even if they take a daily multivitamin. But I take a multivitamin. I hear this all the time. Here is the problem. As we cross the 60-year mark, our stomach acid decreases. This is a condition called hypochlorhydria. Without that acid, your body cannot unlock vitamin B12 from your food. B12 is the insulation for your nerves. Without it, your nerves are like exposed wires touching each other, sparking and short-circuiting. The catch: you can have normal B12 levels on a standard blood test and still have a deficiency in your tissues. Doctors look for anemia, but your nerves start dying long before you become anemic. This is the most controversial one. Your doctor says your A1C is 5.6. You're fine, not diabetic. But research now shows that postprandial spikes, the huge surge in blood sugar right after you eat a piece of bread or a bowl of fruit, can cause glycation. Glycation is when sugar molecules stick to your nerve proteins like metaphorical superglue. This caramelizes the nerve endings. You don't need to be diabetic to have sugar-coated nerves. You should never stop medication without a consultation. But we have to talk about CoQ10. Many seniors are on cholesterol-lowering statins. These drugs are great for the heart, but they also accidentally block the production of CoQ10, a nutrient your nerve mitochondria need to produce energy. If your nerves run out of battery power, they start to wither. So we know the why. Now let's talk about the how. How do we wake these nerves up? 1. The 10-minute nerve flush. Why walking isn't enough, but specific movements are. 2. The methylation solution. Why you need methylcobalamin, not just standard B12. 3. The alpha-lipoic acid factor. The universal antioxidant that has been shown in clinical trials to actually regenerate nerve signaling. 4. Anti-inflammatory eating, eliminating the big three oils that act like gasoline on nerve fires. Your idiopathic diagnosis isn't a dead end. It's just an unfinished book. Your body has an incredible capacity to heal if you give it the right raw materials and remove the obstacles. Don't let anyone tell you that living in pain is just part of the package of being over 60. You've worked too hard to spend your golden years feeling like you're walking on broken glass. If you want the specific list of foods that boost that nitric oxide we talked about, click the link in my description for my Nerve Health Grocery Guide. And if this video gave you even a glimmer of hope, hit that subscribe button. We're on this journey together.